next speaker is the co-founder and COO of Launchworks. She has been spending 20 years of her career, last career, really working with companies to help them to launch, design, scale platform businesses. She spent quite a bit of time with, she was a senior exec at eBay, and she's been one of 8 experts advising the World Economic Forum. Oh, sorry, there we go. Thank you. They're good at taking care of me. Working at the World Economic Forum, and she's also the co-author of Platform Strategy and Mission BlaBlaCar. So please welcome Laure Reillier.
So delighted to welcome Ruth Cousens. So Ruth, you're the co-founder and CEO of This Labs, who originated from Cambridge University. And I'm also delighted to welcome Mathilde Konczynski. You're the Chief Medical Officer of MeditSimple. You're a doctor and also an osteopath, so it's quite a rare combination. And I'm also very happy to welcome Charles Armitage. You're the co-founder and CEO of Florence. You're also a doctor, right? And you've raised over $35 million over the last few years. So welcome.
Thank you.
So today we're going to talk about healthcare. So there's a big gap today between people's expectations and what healthcare systems have to offer. And there's a number of reasons, obviously, demographics, but also because people are now today used to choice, convenience, and speed for all sorts of services. On-demand shopping, booking a taxi, booking a holiday, and of course the platform economy has something to do with that. But when we look at demographics, obviously, the populations in developed countries are getting older, and so, the more resources you add, the more resources you need. And in fact, when you look at the NHS, there's already 1.5 million people who are employed by the NHS, and that's an increase of 30% since 2009. So, they've increased their numbers a lot, but there's still a shortage of staff, isn't it? So as a result, we end up with really huge healthcare systems. They often are run in a linear way. They often are run in silos, fragmented, with lots of inefficiencies and complexities. So really, our healthcare systems are on a cliff edge. The question we're going to discuss today is how digital platforms and AI can help solve the healthcare crisis. So I'm first going to ask you to describe your platform, perhaps starting with you, Mathilde.
Yes. Hi, thanks for having me. MeditSimple's a platform that we've developed to optimize patient pathways. So the idea is that the patient will go on the platform, input their symptoms in a few words, be prompted with medical history and medications, and we'll guide them to the next best step of care. The idea is to empower the patient to make sustainable and understood and informed decisions about their care. And the ultimate goal is to optimize a resource allocation, essentially, and reduce waste in healthcare.
Ruth?
I'm the co-founder and CEO of This Labs, which runs the Discovery platform, and we exist to really help the problem of adoption of innovation and improvement in healthcare systems, and particularly from the perspective that the best products and services often fail in healthcare because they don't take the needs of patients and staff and the public into account. And so products are developed that simply don't land because they don't understand the system that they're landing into, they don't understand the real life needs of patients. And so what we do is we run an online platform which is essentially using qualitative research methods in order to gather insight from patients and staff at scale. So this work is often done in very small groups in a face-to-face way, but we allow it to happen at scale using our platform. Our clients can be anybody from very small new startups who are looking to design new products, to people like NHS England, who are the kind of main structural funding organisation for the NHS, who are looking to design new approaches to delivering health, new pathways, for example. And we have about 11,000 people registered on the platform. Currently, we recruit new people all the time. We've used a very good example of the way that we've used the platform was in partnership with colleagues at the University of Cambridge, where, as Laure said, a University of Cambridge spin out, and the Royal Colleges of Obstetricians and Gynecologists and Midwives to design new tools and training for monitoring labour. So over 1,500 people, including people from the different professions, but also people who've given birth in the last 5 years, birth partners and others, were involved in developing those new tools, which are now currently being piloted in 9 sites across the UK. So that's the kind of work we do.
Charles.
Hello everyone, thanks for having me here. So my name is Charles, I run a company called Florence, and what we do is we help healthcare organisations build a flexible workforce. Previous life I was a doctor, and about 7 years ago saw some of the challenges around the healthcare workforce, which I think is probably one of the most existential issues we have to deal with in our society, is how we build a workforce to support this impending demographic tide that we've got coming. Saw some of the challenges, decided to build a platform to solve that, and actually ended up reading Benoit and Laure's book about 7 years ago, and was a bit of a kickstart for me to start Florence. So if you haven't read that, I'd recommend it. I think I'm getting commission, am I? Or and
if you want to get rich, don't write books.
Yeah, so yeah.
I'll tell you that.
Yeah, don't start a company called Florence either. But so essentially we help healthcare organisations build a flexible workforce and help them support some of their supply challenges they have around their different types of flexible workforce pools that they use. We're mainly in the UK. We've recently launched in France and Canada, and it's all going great. So really appreciate being here.
Thank you. So I first want to ask you, how's your platform model as a business model key to your development? Perhaps, Mathilde, you want to start first?
I think MeditSimple's platform is key to the development, definitely. I think there's different elements to it. We've got a big scalability from the very much patient-centered kind of element, and that drives network kind of effects and increases growth quite naturally. We've got diversified revenue streams which help as well, and with the way the platform's been designed is very much with a kind of view to internationalizing it. So I think yes, it's been designed to be able to be spanned out, essentially.
Yes, I think it's really critical to what we do, and just to re-emphasise what Charles said, it was reading platform book that really actually made me realise that what I was doing was running a platform, in fact. So attracting participants to take part in these kinds of insight gathering projects and matching them with the right clients is fundamentally a platform job, essentially. And what it enables us to do is do the work that we do at very large scale. It gives people, so the platform gives people a place to put the huge amount of goodwill that people have towards health systems and also towards other people in the community. So building, trust around, if I contribute to this project and I give my experience, my expertise, whether it's professional expertise or lived expertise of a health condition, then I am building a new, better, more innovative, exciting way of delivering healthcare services. And we always focus the work we do on a really concrete problem. So we're not asking people to sort of throw ideas into the air. We're focusing them on actually developing and designing specific things, and the platform enables us to do that at scale in a way that wouldn't be possible in any other way, but it also builds those lovely network effects of trust between the participants and the people running the projects as well.
I think for me, and maybe this will get a bit granular on workforce deployment, but when you're thinking about how you deploy a healthcare workforce, which is what we do, there are three kind of core jobs that need to be done within a technology. And the technology provides value, but really the value is in the supply and the demand on either side of the marketplace. But ultimately what our technology allows that supply and demand to do is do three things. One is build trust through things like credentialing and onboarding to make sure you're getting the person who is doing the work is qualified to do the work and safe to do so. Two is to match supply and demand and make sure that when you've got the demand for a intensive care nurse of a certain level in this postcode area, that it finds the right person to fulfill that role. And then third, you've got to employ and pay and bill the right people. And so ultimately, I think those are the three core building blocks of what we do in that workflow. And yes, the technology enables that to happen in a really seamless, user-centric way. But nothing would transact without the supply and the demand on either side, and that's why we spend a lot of our time thinking.
So how do you think about the customer experience on all sides? And I know that for some of you there are two sides, and perhaps for others there are multiple sides, right? So that can be a challenge because obviously you have to think about the different customer types at the same time.
How do you make an experience that sort of balances the requirements to both sides?
Yes.
Yeah.
How do you
it's always a challenge, right? And I think the way we deal with that is just through transparency, right? So, I'll give you a really granular example, right? If you are a hospital organisation that books a nurse to do a shift and the nurse doesn't turn up, the nurse wants to have the flexibility to not do that if something happens in their life. Well, for the hospital, that's a really very negative event for them. And we've had a lot of back and forward on how we manage rules of engagement within the platform. And I guess ultimately what we've landed on is we've created a very clear set of criteria for behavior on both sides of the platform. And then rather than trying to discipline people either side of the marketplace ourselves based on that, we present that as transparently as possible to the other side of the marketplace, well, to both sides of the marketplace. So whether you're an organization that uses Florence on the demand side or a healthcare worker on the supply side, a key part of your profile is your performance metrics around reliability, quality, responsiveness, all these kind of things that are important, and actually people really buy into that. And it means that as a platform, it becomes a self-fulfilling cycle of quality because high quality employers and high quality professionals end up getting more and more opportunities, stick around for longer, drive lifetime value, whereas lower quality employers or workforce tend to drop off the bottom and leave the marketplace. So generally that quality score, which we do regular NPSs and CSATs across all of our customer base, and we just see that going up and up and up as the marketplace manages itself.
What about you, Ruth?
Yeah, so on the kind of client side of the platform, we as a team mediate a lot of that experience. And so we're aiming as we grow and improve our technology to allow more access to that for the clients. But at the moment, the customer experience is very much on the participant side of the platform. And so really that is about providing the easiest, most accessible, most engaging, most straightforward way of participating in projects, which is kind of difficult because what we're also trying to do is slightly more nuanced techniques of gathering insight. So not just simply a survey, although we absolutely run surveys, but actually we engage people in things like consensus building processes, which actually take multiple rounds of participation. And so we do come in with the fair wind of this, huge amount of kind of goodwill and enthusiasm that people have for participating in these projects. But as you will know, if you run a platform, as the first minute they reach a blocker, they go, I'm leaving this and I'll come back in 5 minutes, and I never come back in 5 minutes. So that the ease of getting somebody through that process is absolutely critical. And of course, we do lots of user research on that. And I would say that a kind of critical issue of it is balancing the needs of a good, rigorous, useful piece of research or insight gathering with the ease of getting somebody through that process. Because let's face it, we're talking about the most time-strapped people in the country, if we're talking about NHS staff, or we're talking about people who inherently have, much going on in their lives in terms of potentially dealing with multiple conditions, or, caring for people with multiple conditions. So that's our kind of real focus, is just the streamlining of that experience to get that insight in as efficient way as possible. And sometimes people do say that participating in our projects is fun, but we feel that's a bit of a high bar to set ourselves for every project.
So Mathilde, in terms of the customer experience, you mentioned, I picked up on the word efficiency and sustainability. So how do you, could you elaborate?
So
on
I
that
think
a bit, please?
our platform's designed like a marketplace, and we essentially have onboarded all of the actors of the healthcare ecosystem. So we have a lot of different types of clients. We have patients on one side, we have professionals on the other, we have payers, so insurance companies, and one could imagine as we develop maybe even government-run agencies and things like that. We also have pharmacies and labs and imaging departments. So we have really a lot of different people. So what we've spent a long time doing when we were setting up was actually making sure that there was a very clear value proposition for every different actor, and that value proposition is very different. So for example, for patients, we're very clear, obviously we're transparent throughout everything, and I think that, as you were saying very rightly, Charles, builds trust. But I think for patients, we make sure that their pathway is streamlined, that they have an experience that really guides them, and they feel supported throughout their journey. So there is no loss in there. I think patients often come to the platform because they're lost in the system. What we don't want them to do is to get lost on the platform. So there's this need for very, very fluid, efficient process for patients, and there's a lot of patient feedback coming in. It's excellent. And we spend a lot of time working with patients to make that more fluid. With regards to professionals, we improve their experience by making sure that there's very clear kind of expectations. They want to be more visible. They want to be more understood by patients. They want the right people coming to them, because they know that if they get the wrong patients, they get very bad feedback, because it's just not what people are expecting. So it's matching the right person with the right patient. And the same thing goes for all of the other actors, really. We've introduced payers recently. That's the last step of our expansion. And for payers, it's a slightly different concept. They're coming in because they're interested in obviously saving money. We're in a resource poor environment, but they want to save money without compromising on care and without compromising on quality for their clients. So again, it's making sure that we've got the right expectations and we're building towards them. So it's been a step-by-step process, and it's been a little bit here, a little bit there, and we've kind of worked around the ecosystem. But yes, I think that in a nutshell.
Great. So let's move to scaling, because obviously scaling is critical to have massive impact as a platform. So what strategies have you found effective when scaling your platform? Perhaps I'll start with you, Charles.
Sure. I think that's a broad question. One of the things, so in the last 18 months, we've launched in a couple of new markets. We've taken it from the UK to France and Canada. And I think there have been a number of learnings from that. Number one is how lucky we are to have an amazing technology team that's built a very flexible platform. So I can imagine that would have been a problem for a lot of people, but those core building blocks that I talked about, onboarding, credentialing, brackets, trust, matching supply and demand, paying and billing, we've managed to build very flexibly across different markets and can kind of drag and drop solutions into each place. So that's good, because there are differences between each market. The challenge that we find, I guess, is that whilst network effects are extremely powerful within an individual market, so within the UK we have a flywheel going where we don't really have to spend anything on acquisition on the supply side of the marketplace. It all comes organically. As soon as you enter a new market like us, you get very hyper-local. It's all hyper-local, so there are no network effects, and we've had to start from scratch again. So relearning some of those acquisition funnels from like our early days in the UK have been maybe a little bit more challenging than we thought. But I guess we have got a bit of a playbook about how to do that properly.
Do you send a local team over there, or do you?
Yeah.
Okay.
Yeah. We have a central UK team that manages things like technology, finance, people, marketing, all those kind of things. But then we definitely have a very local, extremely local go-to-market team.
What about you, Ruth?
Yeah, I think we're in a similar position in terms of technology in that we're very lucky to have very robust technology that has the capacity to take on a lot more than we're demanding of it at the moment. We're very early days, so we're only 18 months old as an organisation, so I'd say we're right in the throes of working out how to make scaling work. And it's very chicken and egg because, you know, the more participants we have registered on the platform, the more attractive it is to clients, but in order to register participants on the platform, we have to have projects that clients have brought to us to want to do. So we've been trying to intervene in that kind of chicken and egg issue by really targeting and developing projects that are explicitly designed to demonstrate the value of the platform, but also to be very broad-based and things that lots of people can participate in. So if you go onto our platform at the moment, you will see some of the projects up there around dementia diagnosis, which is sadly something that many people have experience of. They're around attitudes to cancer screening. So we're doing a really interesting discrete choice experiment, which is quite an involved process around attitudes to cancer screening, which, you know, many people have opinions on. So I guess what we're trying to do is take kind of really deliberate steps to intervene in that scaling process with projects that we think are really attractive, both to clients and to participants, in order to get the flywheel going, because we're definitely still in the phase of kind of the heavy bit of the flywheel, I would say.
I think scaling, again, similarly, I think we're very lucky the platform has been built for scaling, so we don't have the technological stumbling block. That's very helpful. We're currently in the process of scaling mostly in the UK, although international scaling is planned in the near future. But I think our scaling strategy has been, I mean, as I said, we talked about network effects, and I think there is definitely a network effect with regards to patient-centered. So the patients are talking, practitioners are using it, and so there is this natural kind of growth. We found the best scaling strategy for us was actually accessing payers, because payers are insurance companies, and particularly international insurance companies. They come with their own clients, they come with their own professionals as well, and so the onboarding is a lot easier for everybody involved when there's kind of one communal actor involved. And same thing goes for international scaling. So I think the plan for the international scaling is to start off in the international companies, so that we'd already have kind of targeted areas that we know we're going into, and then essentially building up from there. So yes, it's definitely dependent on good technology base, which we're very lucky to have.
Great. So I want to move to the question of AI now. So of course, AI means lots of things, you know, lots of types of AI. There's generative AI, there's machine learning, but how have you found AI useful in your business, being, you know, matching customers, or matching both different sides, being interpreting results, being advising clients? What's been your experience so far? Mathilde?
So AI has been built in from the beginning for us, although it has obviously evolved, as AI has been evolving tremendously anyway. So initially we were using it mostly to match the right practitioner with the right patient. And as it's evolved now with our latest edition, our AI, essentially our AI part, which has come in, and that one is guiding patients. So essentially it is listening to the patient's language, it's responding to the patient, and it's so essentially helping us to understand the patient better, guide the patient, and then essentially match them with the right person. So it's going through the whole thing, but we're using it in every element.
I think for us, the key use of AI is in analysing free text responses. So when you ask people to give you their insights and opinion, you get lots and lots of free text. And it's often a big thing that puts people off doing that sort of work is, oh gosh, I'm going to end up with, you know, 20,000 words worth of text that I'm going to have to analyse. And of course, AI can resolve that problem. Now, my academic colleagues would be very quick to say, you know, to a certain standard and at a certain level. But if, like us, what you're aiming to do is make a quick, high level but useful intervention in an immediate problem, then it can actually be really useful for that. So that's the kind of core area that we use it for. The other thing that we do use it for is transcription as well, because we're increasingly moving to people recording responses, audio responses or video responses, and so it's just another step in speeding up that process again.
I'm not convinced we've really found a really strong use case for nailing productivity improvements through, you know, what everyone thinks of AI is now, which is like essentially large language models, like last couple of years. Yeah, maybe we've made customer service a bit better and more efficient. Maybe the engineers are a bit more efficient with their co-pilots or whatever. And yes, there are some platform features that help customers more. I can't think of anything that I can really put a pin in though and go, we've had to hire fewer people, or this person is like 10x more productive because of how we've enabled that through AI. I think where I do see some changes though is how we use it internally to power our team and help them do more. And I had a really good, but that's a learning thing, and people need to be really curious about that. So I heard it on a podcast a few weeks ago, something we did a couple of weeks ago that was great, is we made, whenever anyone opens their browser, it opens on ChatGPT, so that's their default search experience. And from a personal level, it's been transformative about me thinking, this problem I've got in front of me, how can I use a large language model to solve it? And as soon as you start thinking like that and start iterating and it's practice, right? As soon as you start practicing with large language models, you become a lot more, you realize the world of possibilities. So for me, I think the biggest moves internally in terms of our progress is when our internal team are trained and understand how they can use it to enhance their work.
So AI can also be quite useful in decision making in healthcare, but there are limitations in terms of, you know, what are the ethical limits. So I was wondering whether that is a challenge for you or a concern, and, you know, what steps have you taken in that area?
So one of the crucial points for us in developing our product and knowingly wanting to use AI was that it was extremely important to us all that it was used responsibly. So one of the first things I did when I came on board with Laurence and the rest of the team was actually set up an ethics committee. We consciously kind of went and investigated what other people are doing and big platforms and things like that. And actually we found that hybrid model was the one that we wanted to go for. So it was very important that we had external kind of view into our systems. And I think making sure that what we're doing not only fits in with expectations from all walks of life, but also is essentially safe for everybody to use. As with any new product, I think AI comes with great kind of alert buttons, and I think that certainly as a medic, but as a patient as well, I'd want to know that things are being used responsibly. So for us, the ethics committee has been a nice kind of sounding block. We've been contacting them, and we've had one big meeting. We've got another one coming up in the new year, making sure that we're discussing the challenges, we're discussing the concerns, and we're keeping a transparent kind of tab. So the idea really is to plan developments, develop and use the product in a way that is acceptable to all on the panel.
I'd maybe just take a slightly different angle on that question, because some of the work that we're now doing is starting to understand the acceptability of AI in these contexts to patients and to staff and to wide groups of people. And I think what's really important in that is is to understand what the counterpoint is. So decisions are already being made in ways that are perhaps not entirely logical and rational, and we would like to think that that's how healthcare is delivered, but we also probably in our hearts know the reality that there are a whole range of different motivations that go into making decisions, like risk stratification, right? So if you're deciding who's going to be the next patient at the top of the list because they're the riskiest, you know, there are different ways of making that decision. And so I think a lot of the things that we're thinking about in the projects that we're running running are around how do we make a realistic range of trade-offs that people can kind of articulate their preferences around, right? So it's not either everything is rosy or the robots do it. Like those two, that's not a nuanced conversation. So we're trying to promote in the work that we do a nuanced conversation around that.
Yeah, I think the conversation about AI in healthcare is very similar to fully self-driving cars. So, fully self-driving cars are, of many order of magnitude safer than a human behind the wheel, which is a very dangerous thing. They're very dangerous things to do, relative. But how many orders of magnitude does it need to be better before it's something that everyone's comfortable with? Like 100, 1,000, 10,000, a million times safer than a human driver before people are comfortable getting in a fully self-driving car? I think it's a very similar debate in healthcare, and people are very nervous about, black boxes, human out of the loop thinking within healthcare. The reality is that healthcare is really dangerous and is in many ways provided in a very unsafe way today. So whether that's understaffing, people being tired, systems being crap, ceilings falling down, whatever, there's certainly within the UK, the safety bar in healthcare is dramatically low. And I think one of the core drivers around that is resources, and we don't have the resources or the workforce to provide really high quality safe healthcare at scale. And I think if we're slow and resistant to use AI to try and augment that workforce, there will be much worse patient outcomes than if we are brave about it. But it does obviously require a good comms strategy, because it could go pretty wrong.
So what kind of collaboration between companies like you, digital platforms, but also government bodies and other stakeholders, what kind of conversation should take place so that we improve the current system that we've got today?
I mean, I think for me, and apologies if there is anyone from government or NHS here, but it's as a private provider trying to innovate within the government healthcare sector in the UK, it's extraordinarily difficult. The anti-commerciality that exists within the public healthcare system is crazy. The lack of decision-making capabilities and the ability for people to take risk is very, very poor. My job and our job as a team is to try and help push that innovation and tell that story. But I do think the way the system is set up at the moment is a huge, huge barrier to some of the progress that I think we need to make if we are going to keep healthcare free at the point of access and high quality and safe for the next 10, 20, 30 years.
I think the problem is a total lack of nuance in the conversation. So healthcare is massively complicated and massively human as well. We've already mentioned that the NHS is, I think, the 7th largest employer globally. It's absolutely enormous, and every one of us is either a patient or a potential patient. And the trade-offs that are made day in, day out are enormously complex, and yet the only conversation that we have at a citizen level is, do we want the NHS to be free at the point of access while everybody does? That's not even a conversation. So we spin ourselves into loops arguing about who's trying to privatise the NHS. But I think actually, and maybe I would say this, wouldn't I, but digital platforms and platforms like Discovery enable people to actually have a much more nuanced conversation about much more directly kind of active questions. So how should we be monitoring labour, right? That lots of people have a legitimate perspective on those things. What attitude should we take towards cancer screening? Should we not do screening if it throws up lots of false positives? And if you look at countries like Taiwan, they are looking at loads of really interesting ways that you can use digital methods to intervene in democracy and allow the citizenship to have a much more involved conversation with their government, rather than we're going to vote for you this time and 5 years later we'll vote for the other guy, and in the meantime we'll row about who's privatising what. So I'm actually very optimistic that the kind of conversation is progressing in a really productive way towards much more kind of participation in a much less polarised and much less idealism-driven fashion, if that makes sense.
I think that that's one of my passions, actually, public health, particularly the NHS, because I am a big fan of it, actually, or when it works. But I think that for me, the issue is that the NHS is fractionated. Nobody really knows who makes decisions within it. And I think that because nobody really knows who makes decisions with it, most decisions that are made politically. They're not made really, unfortunately, in the greater, for the greater good. And I think that what is coming out of certainly our platform currently, it would be such an ideal tool for a government, because you can have transparency. Currently, hospitals, NHS hospitals that want to outsource anything have no way of picking their provider. So they will pick the provider that is the provider they've been matched with. That provider can have any cost they want because there is no competitivity there. That is not right. There is so much that can be done, but it has to be treated as it is, what it is, a marketplace with public funding that is funding it. And I think that until we accept that healthcare is essentially something that costs us money and that should cost us money, we all need to be treated, there will be a problem. And I think this refusal to discuss finances and healthcare at the same time means that it remains fractionated and that it remains an extremely expensive system where the money isn't spent where it needs to be spent. So I think it needs to be a conversation. I am also very hopeful. I think that the governments are making more and more noise towards actually wanting to innovate and listen to the ideas out there. There are so many products that would be beneficial currently, and I think I'm very hopeful that they will start to listen to us all.
I was just going to add, so the UK government at the beginning of last week has launched a consultation called Change NHS. And immediately the news stories were about the British public does have a wonderful sense of humour, and immediately people were suggesting, the catapulting dear old West Streeting, out of a water cannon or whatever it was, or beer taps in every hospital ward. But I don't think we should write. I mean, it's easy to write it off, and laugh at it. But I don't think we should write it off quite so easily, because actually, if you go through the comments, people are making really super sensible comments about things that could actually change for the better. And so, as I say, I worry that people will kind of throw the baby out with the bathwater and say, oh, it's all silliness, or it's all it's all comedy, because I don't think. It's the first time in my memory anyway that any government has really explicitly said, before we develop this next 10-year plan, we want to hear from people. We want to understand what you think. We want to understand that. Now, of course, they've got to follow through on that, and that is a whole different ballgame. But, I'm just a slight plea maybe not to kind of write it off too quickly.
So if there was one thing that you could change to make healthcare systems more human and more sustainable, what would it be?
I'd put everybody on our platform.
That's cheating, you can't say that. I think from my perspective, it's to really be mindful of that adoption gap, right? We'd all like to think that we all as humans behave entirely rationally and take our pills as the doctor tells us to, and do the exercises the physio prescribes and all of those kinds of things. But actually, we don't. We do the thing that's most convenient for us. There may be barriers to me doing something that are just not transparent to somebody else doing something. And so, to really understand adoption and to really make adoption happen, and this shift about moving towards digital, which is such an emphasis in the UK at the moment, you really have to have compassion and understand how that lands with people across the system. And that's how you get adoption, and that's how you get scaling of technology across the system. You have to understand the people.
It's a slightly contrarian view, but I think everyone hates healthcare managers, but I think we need to have much more of them, much higher quality, and therefore pay healthcare managers a lot more, so you can ultimately improve productivity.
Okay, great. So I think we have a little bit of time for questions. Are there any questions here in the audience, in person or online? Yes, there is one question over there.
Thank you very much, and thank you very much for an amazing panel just now. A quick question, I guess, again about like this communication between the NHS and the private side of things, the business side. Is there a dialogue being fostered right now? Or to add to the question that was asked before, are you incentivized in any way from the NHS side? I just heard you, like the communication is broken, but are you incentivized monetarily or somehow else to be dealing with the issues that the NHS is faced with?
I think I can take the first bit on incentivization for improved communication between the public sector and the private sector. I think there is increasing privatisation within services in the NHS, which is, I think, a very, very good thing. It's a completely separate question to what I think most people believe in, which is a publicly funded system that's free at the point of access. The problem is that this conversation about privatising the healthcare system is like a huge political, red mark. And that means that it all goes on very quietly behind closed doors, and you read Daily Mail headlines about how many knee operations have been outsourced to Spire or Nuffield. And I think that's a really bad thing to talk about. We should be talking about patient outcomes and quality scores, not whether it was done in this hospital, which is publicly run, or this hospital that's privately run. I don't care. I just want to have good outcomes. So there is increasing privatisation and conversations going on about that. Great. There should be more, and it should be much more open and supported.
Well, there's one final question, and I think then we have to stop. Oh, maybe Kapul? Alan? Yeah.
Thank you. I mean, we're all doing so well. I'm about to turn the apple cart upside down. Given that we were talking about AI, is it not time where we as individuals own our own data? And if we own our own data and have the ability to then reach out to best practice, doesn't that fundamentally change the way we look at the NHS and other medical problems? The reason I say that is that you are all data companies, but you're trying to fix a model which respectfully is already broken. So rather than fixing a model that's broken, shouldn't we build a model that could actually deliver a personal health resource to every individual across the country?
Actually, I'm happy to take this question. We're not. I suppose we are fixing a problem, but we have built a model that is fully independent. So the idea actually is that we are providing personalized healthcare. And I think that is the strength of AI. If it's used well again and responsibly, if it is efficient, then what we should be providing is the right answer for the right person at the right time. And I think that is the strength of having something that is greater than one person, because currently, I think, unfortunately, your care is only as good as the first practitioner you see, and I think that's unfair on many fronts. It introduces huge biases, particularly with specific populations that don't have good access to healthcare, and I think that it is definitely about personalised healthcare. So we are certainly, our platform, building a model that is a new model, that is a model of the right care at the right time for the right person.
But if I can just mention to Charles, you're doing the same thing. You're actually helping people get employed, whether it's by their location, by their expertise. You're matchmaking, dare I call it dating, but you're matchmaking people's competencies with needs. That is, again, a game changer. So I think there is a need for people to listen to bottom-up capability rather than everything being done from the top down.
Thank you. Thank you very much. I think we've run out of time. Thank you, Mathilde. Thank you, Ruth. And thank you.
Thank you very much.
Yes.
Thank you.
Thank you, Charles.
Thank you.
For this excellent panel.